Hello, everybody, and welcome from the UNESCO Chair for Global Health and Education. We're delighted to see you joining us this afternoon for an interactive webinar entitled Connecting Health and Education to Unleash Learners' Potential. We have a fantastic panel of speakers for you, and please feel free at any point that you like to pop a question into the Q&A function that is at the bottom of your Zoom screen. I'm Nicola Gray. I'm the co-chair for the UNESCO Chair of Global Health and Education, and I co-chair with Professor Didier Jourdan of the University of Clermont-Auvergne. But I am in the hot seat this afternoon. I'm very pleased to be here to welcome our speakers and this audience. What's exciting about this report and about this, this discussion that we're going to have is the multi-agency aspects of this. That health and education are mutually beneficial, and that we've got to stop our silo thinking to make sure that health and education are working really effectively together so that our children and young people have the best possible future health, future outcomes, future prospects in a very challenging world. So without further ado, let's hear from our excellent speakers. But before we do this, we're just going to talk through some of the practical aspects. I've already asked you if you will ask your questions using the Q&A at the bottom of your screen. Be fantastic, thank you. And we have some interactive questions to start. So we use an app called WooClap, and you may already have it on your phone, but there are several ways in which you can connect with it. There is a QR code here. So if you take a picture of the QR code with your camera, that should take you straight to our app questions today. There is also a code that we can see there, which is 25 April 23. And if you already have a WooClap, or if you are working on the web, then you can put that code into the WooClap system and you will be able to bring up the questions. And Sylvia has put the web link to WooClap and the code that you will need to get into our questions in the chat, and I hope you can see them there clearly. So we'd like to find a bit more out about our audience before we get started this afternoon, and so we're going to start with a question to get you familiar with using the app, which is, where are you? Okay, so it'd be fantastic to see where you are joining us from this afternoon. So if you'd like to start with that first question. And then I think what we can do is we will answer all the questions and then we'll look at all the answers. So the second question is, I am A. And A, if you look at the app, relates to the kind of role that you might have. So you might be a researcher, you might be a policymaker. So please tell us. If you find a question where you have to answer other, then please tell us in the chat. And again, it's been fantastic to see people already introducing themselves from Kenya, from Cameroon, from India in the chat, and please feel free to do so. So the second question is about your role, and the third question is about your background. And your background might be health, be it healthcare or public health, health promotion, health education. It may be an education role. We're talking all about schools this afternoon. It may be in food systems and nutrition, and that's a big focus of the report and our discussions. So hopefully you will see something that looks like your background, but again, if you want to press other for the question on WooClap, then please put a little bit more, tell us in the chat. Okay, so those are 3 questions for you to answer. You'll be very familiar with WooClap, and you'll be ready for the interactive questions that are going to run alongside each of the presentations we have this afternoon. We'll just give 1 more minute, and then I shall ask Sylvia, and I shall introduce Sylvia de Ruyter, who is our technical wizard for this afternoon and who is project manager for the UNESCO chair based in the Netherlands. Delighted that Sylvia is joining us today. The other member of the chair's secretariat who is here with us today and who will be coordinating the Q&A for us is Rolf Bouws, who is the manager of the chair and the secretariat. So we're delighted to have Sylvia and Rolf as our technical wizards today. Okay, Sylvia, do you think we're ready to reveal the answers to these questions, please?
Yes, definitely.
Mhm. Where are you? Okay, so I can see some clustering here. And of course, with our time zone, we will look forward, if anybody is watching this recorded later on from other world regions, then we're delighted to have you here as well. And thank you for coming to watch the recording. So we can see here clusters in Europe, but we have viewers from Africa, we have viewers from Asia here. This is fantastic. Okay, so that gives us an idea of where we are. Now, the roles. Okay, so we have researchers. This is fantastic. We know we've already got researchers, practitioners, policymakers, students, and others here. So we've already got a diversity of audience. And yes, please feel free if you'd like to keep adding your answers and adding yourselves to the questions, then please do. So fantastic. We've got people here from all types of roles. And then interesting, okay, so and we can see this is very dynamic, it is moving as we speak, but we've got a lot of health promotion colleagues here today. We have some healthcare colleagues, education colleagues, and others. So nobody as yet who classes themselves as food systems and nutrition. Obviously, those silos, you know, that we've got people who are interested in topics coming from all the different parts of the health and education spectrum. Fantastic. Well, I hope that that's given you an idea of what WooClap can do. And as I say, we're going to be coming back to it with each presentation to give some really nice interactive opportunities for the audience. And so I shall move to our first presentation. Okay, and for this presentation, I'm going to give a short introduction. Then there will be a short video about the report, and then I'll be delighted to hand over to Chris Castle. Now, Chris Castle has more than 30 years of development experience in the areas of education and health. He's been working at UNESCO in one role or another since 2004. So after holding a position at UNESCO's International Institute for Educational Planning, he transferred to headquarters, where he served as the chief of the section of health and education until November 2022, and where we as the chair have been delighted to work with him. And now we're really excited about his new role as Director of the Division for Peace and Sustainable Development, and delighted that Chris can be here with us today to talk about this report that I know he's so enthusiastic about. So team, we're ready for the video, and Sylvia, are we going to you for the video?
Every child has the right to learn and thrive, but for many, poor health and nutrition stand in the way of their well-being, their education, and in turn their future. Investing in school health and nutrition has far-reaching and positive impacts on learners. Yet children and adolescents are still missing out, especially in the poorest countries and most marginalized communities. Almost 1 in 3 schools globally do not have safe drinking water and basic sanitation facilities. And while almost every country in the world is offering school meals, an estimated 73 million of the most vulnerable children still do not benefit from school feeding. We know children and youth learn better when they are healthy, happy, and full from a good meal. Ready to Learn and Thrive was written by the Interagency Group on School Health and Nutrition to show the far-reaching benefits of school health and nutrition on learners' health and education. For example, school meals alone increase enrollment and attendance by 9% and 8% respectively. Deworming and micronutrient supplementation can add 2.5 additional years of schooling in areas where anemia and worm infections are prevalent, and school skipping is reduced by half when tackling school violence and bullying. The evidence is clear. Providing nutritious school meals, fostering a safe learning environment free from violence, promoting physical and mental health, and offering skills-based health education and services are affordable and practical solutions that have ripple effects for learners, communities, and countries, especially when combined. What are we waiting for? We must do more and better together to empower all learners to learn and thrive. Download the report now.
Thank you so much for the video. Whilst the slides are being set up for Chris's presentation, let me tell you the question that we have asked Chris this afternoon, which is, what is the status of school health and nutrition policies and programmes around the world? And what are the main takeaways from your research? Thank you, Chris.
Thanks very much, Dr. Gray. It's a great pleasure to be here and to be with you once again as one of our esteemed UNESCO chairs. It's a wonderful opportunity to share with this group this important question that you've raised, and in fact, the report we think helps to do that, which is really designed to kind of give us a better sense of what the status of school health and nutrition is from different countries all over the world. And for many years, we've known that we have different data sources to relate to different aspects of school health and nutrition, but this is really the first time that a report of this nature has pulled all of that data together from over 40 different data sets to present in a comprehensive way, or at least the best we have at the moment, a sense of what the status of school health and nutrition is. So as Nicola mentioned, this report was really a collective effort that was produced with a number of different UN agencies that you saw in that short video, as well as the Research Consortium for School Health and Nutrition, the UN Nutrition Secretariat and the World Bank. So there were really a lot of different agencies and partners coming together to contribute, to share their data sources, and importantly, to help us think through and analyze what the data means. And I want to also particularly thank Dr. Gray and Dr. Bundy, who's also participating today, who were part of the technical advisory group of 13 experts that helped provide strategic guidance throughout the process. So in terms of countries and schools and promoting health and well-being, we've identified a number of things that I think many of you participating in this webinar will know are important. We looked at policies and laws. We've looked at education for health and well-being, particularly those delivered through skills-based school curricula, as well as extracurricular activities. We've considered the importance of a school physical and socio-emotional environment, and as the short video mentioned, that's safe, inclusive, and conducive to health and learning. And then also considering school health and nutrition services, which is also a key aspect of our consideration. So the report really concludes around 6 key messages that I'd like to share with you today. And again, I'm presenting this on behalf of all the different partner agencies that I mentioned who have collectively pulled together this report, and some of them have also presented the report themselves in other fora. So maybe some of you on this call have even benefited from an opportunity to learn a little bit about this report and its findings already. So I'm going to walk through these 6 key messages, and then I know we're aiming to have an opportunity for discussion. So our first key message is really reminding us that health, nutrition, and the well-being of learners are that is a key determinant of education outcomes and must be an integral part of a good quality education. So it's the first big key message that we've reached through this report is really reminding us all how critical health and well-being are for learners as for them to be able to learn. And again, we know that when children are healthy and well-nourished, they learn better. And when they're not healthy, if they're hungry and suffering from ill health, etc., they're obviously not as likely to learn as well. So part of this conclusion also for us was just a reminder that school health and nutrition programs are an effective and feasible way to improve both school participation and learning, and to optimize significant investments in education. I'm not going to go into a lot of detail, but I just want to mention that, for example, when we have water and hygiene services available or WASH in schools, we can see that between 21 and 61% a reduction in absenteeism in low-income countries. So when WASH facilities are available, there's less absenteeism, quite significantly in some places. And when school meals are provided, enrollment and attendance rates can increase by 9% and 8% respectively. So 8% increase in enrollment and 9% increase in enrollment and 8% increase in attendance. So there's really so many benefits that we know can accrue from investing in the health and well-being of learners through school health and nutrition. Our next key message is that, and here's some good news, almost every country in the world, 90%, implements some kind of school health and nutrition program. And the data very clearly showed us, how much school health is already and has been for many years an important and significant part of programming in schools. And many countries are already implementing a number of these activities. So, for example, UNICEF data shows us that about 70% of low and middle income countries are implementing programs for adolescents. More than 100 countries in more than 100 countries, 55% have school-based vaccination programs, and these have contributed to overall increases in vaccination coverage. And as we saw in the short video, more than 450 million school-aged children are dewormed every year in schools in low and middle-income countries. So lots of things are already happening around the world when it comes to school health and nutrition. However, we also know that despite policy commitments, there's limited evidence to the extent to which schools are able to deliver comprehensive health-related education. So in other words, there's some services, there's aspects of school health being implemented in health education, but it's not as scaled up and consistent as we think it can and should be. And when it comes to school feeding programs, we know that this is the world's most extensive social safety net, and it provides school meals to 388 million children worldwide in 2020. And most recent latest figures released last month tell us that that's now increased to 418 million children in 2022. So really, literally millions and millions of children are benefiting from school feeding programs around the world. Even if we know we have a lot more we have to do, it's not an unimpressive level of investment and action in terms of learner health and well-being. Our next key message really is around the fact that school health and nutrition programs are feasible and they're cost-effective, and they work in all settings and benefit multiple sectors. One of the reasons is because these programs deliver immediate and lifelong benefits for individuals. And they also, of course, contribute overall to the better sustainability and inclusive growth of nations. One example in the report is that school meals deliver $9 in return for every dollar invested. So it's easy to persuade decision makers when we are able to present this kind of data. For every dollar, you get $9 in returns when it comes to school meals, or when it comes to mental health, we can see a return on investment of $21.50 for every dollar. So these are really very compelling and I think persuasive reasons why investing in school health is cost effective and makes sense. Our next key message, though, is that really we need to do a lot more, especially to reach the most marginalized. It's pretty clear that the children and young people around the world who will benefit most from school health and nutrition programs are those who are the most marginalized. And the evidence shows that we can deliver the greatest benefits to the most disadvantaged children and to girls. Programs on mental health, school meals, vaccinations, they're just simply not reaching those who need them the most. And so, for example, in the report, we found that 51% of countries globally provide school-based mental health programs, only 50%. And I think all of us are hearing that mental health is now something that everyone's so much more aware of, particularly after the COVID-19 pandemic and confinements and school closures. And then if we look at low-income countries, it's only 24% who are able to provide mental health services. So really, the need is great. Everyone's acknowledging it much more than ever before, and yet the coverage remains low, particularly in poor countries. Our next key message is that we need to pay a lot more attention to the school environment, and that's really critical for health and to learning. And one of the, I think, standout findings from the report is that almost 1 in 3 schools worldwide do not have access to safe water and adequate sanitation. 1 in 3 schools worldwide. So that's really a major challenge that we need to address in terms of responding to the challenge for so many things, including, for example, preparing healthy and safe meals. So really, water and sanitation, safe hand washing facilities, they're essential for preventing illness and enabling girls to manage menstruation and so many other things, infectious outbreaks in schools, etc. So this, paying attention to the school environment is really critical. And again, in low-income countries, they suffer the most from this challenge. And around half of children in schools in low-income countries, are without water services and are found in the least developed countries. So it's really, you know, pretty alarming. And then in addition, there's other infrastructure issues that are important for children with disabilities, and that remains a challenge. And it includes children who, you know, whether it's vision, hearing, or other physical and mental disabilities, obviously those things can affect their ability to learn and their overall general sense of well-being unless they're properly and adequately supported. So that the issue of children with disabilities was something clearly standing out in the data that we found. Let me move on now to the final key message that we had from the report, which is really just that strengthening our coverage and impact requires that programs are comprehensive, respond to context, and are sustained. So as we saw, almost every country, over 90% of countries around the world, have school health and nutrition programs going on, but they may not be we may be missing opportunities to optimize those programs because they're not as comprehensive as they could be. Their coverage isn't as much as it should be, whether it's urban, rural, or certain regions or districts in the country, et cetera. And they need to really be very specifically tailored to the local needs and context, and then ultimately make sure that we're sustaining these for current and future generations of learners. I think many of us, if not everybody in this webinar, will have heard about the importance of whole school approaches for so many things when it comes to education and sustainable development on a good quality education. It's really also very important for school health. And what we found was that the whole school approach is best established in Europe, whereas in many other places, the whole school approach is not perhaps as well known and understood and being implemented. Finally, in terms of policy and financial commitments, we know these are obviously necessary to sustain comprehensive programs. And when it comes to school health and nutrition, and of course, there's an enormous value in terms of political leadership. We know that more than 90% of school health and nutrition programs are funded through domestic funds. So countries, you know, are already stepping up to the plate and not relying on external international funding or ODA to support these programs. So that's, I think, important. And then, again, we've talked quite a bit about school meals, just noting that between 2013 and 2020, the number of children who've been receiving meals in school has grown by 9% and by 36% in low-income countries. So we're really seeing, I think, an acknowledgement of the value and importance of school feeding programs, and we hope that other aspects of school health will follow suit and will benefit from a synergy across the board when it comes to school health and nutrition. Maybe just to wrap up and conclude, I think you know, all of us know that, as I mentioned earlier, the impacts of COVID-19, school closures, and confinement really had an enormous impact. For school health and nutrition, it was also a reminder that schools are more than just places of learning, even if that's their primary purpose. And we, I think, appreciated more than ever before the value and importance of schools to deliver good quality school health and nutrition programs, particularly reaching those who are most in need in the poorest countries. And again, those that are implemented at scale and using innovative approaches to financing and taking into account the importance of coordinated efforts across sectors, not just health, not just education, but agriculture and other sectors is really beneficial and important. And then ultimately, just the importance of improving our own collaboration and coordination. And that's, you know, the interagency group that came together to prepare and disseminate this report has also, as an example of an attempt over the last couple of years to improve our own coordination within the UN system and with multilateral partners, of course, working closely with our civil society partners as well. So maybe I'll stop there, Dr. Gray, but thank you very much for the opportunity on behalf of the interagency group to share the 6 key messages and some highlights from the report.
Mr. Castle, thank you so much. And it's fantastic. There's a lot of good news in the report, but there's definitely a call to action as well to extend to others who may still be missing out. And we will come back to that later. But I know that you've been sharing preliminary findings and highlights with different stakeholder groups. I just wondered whether you're getting some interesting reactions in those fora to the report.
Thanks very much for that question. You know, as I mentioned before, not just UNESCO, but all the other partners have been actively, you know, one of the great things I believe about the report is that there's a lot of ownership by all the different agencies that helped develop it and disseminate it. And we know they've also been helping to share the findings and the results. And what I've seen is this very, very strong interest in the report itself and in the findings. We've heard from within the education, for example, a real appreciation for the fact that it's built on data. And it's built on data that we already had, but we just weren't maximizing. We weren't using it as we should. We weren't pulling that data together and analyzing it in a collective way. I mean, I think, you know, with all due respect to the researchers here in this webinar and who've worked with us, I think we can't always just hand things over to the researchers and ask them to come back to us with everything tied up with a bow. I think those of us who are involved in delivering good quality education and working towards achieving SDG 4, those of us who work in the health sector, who are concerned particularly about you know, the health SDG for health and well-being, we all have to engage in this issue. We have to look at the data and we have to participate in understanding what the data is telling us, understanding where we can make more progress, and contributing really to the thinking around where our investments will have the greatest impact, share and make sure that we're drawing on all the best available, not only data, but also evidence. And that includes evidence from practitioners who have so many years of valuable experience delivering school health and nutrition. So I guess what I've seen though is just a huge appreciation for the process, the data, and the seriousness that went into pulling together really this first ever global status report that was done primarily within the UN to look at the status of school health and nutrition. So thanks very much for that question.
Fantastic. And Hof, may I ask you at this point, have you got questions for us for the Q&A, please?
I do have questions, and hello everyone. There's a lively presentations and introductions going on at the chat, and for the questions are concerned, we have two questions from Dr. Sarita Donti, and I summarized them, Chris. One is, how can we ensure that junk foods are avoided in canteens of schools in the developed nations? And the other question is, how can UNESCO help to ensure that all students are provided with safe water and good sanitation?
Thanks very much for that question. And of course, there's many others participating in this webinar who can also jump in and respond to this. But first of all, what I would say is that the whole issue of the availability of food, which is of poor nutrition value, or junk food, as you say, I guess the question was, the unfortunate reality is that it's pretty widely available in and around schools in so many places. And it's an important question, so I'm glad somebody raised it. I think one of the first things we need to do is work with parents, learners, and the community to find ways to make the school feeding, the school meals that are provided as delicious and tempting and rich and diverse and high in nutritional quality as possible, so that becomes very attractive to children and young people. Because if it's not, you know, it's understandable that they might seek alternatives, and unfortunately those alternatives might include you know, maybe immediate gratification when it comes to junk food, but it's you know, unfortunately the nutritional value is just not there, and it's obviously not good for overall health in the longer term and well-being. And the other thing I would mention, I don't know if we have anybody from WHO on the call, but our WHO colleagues, for example, have been looking a lot at promoting regulations to prohibit the availability of sugary drinks and poor food of poor nutritional value in schools, and promoting policies that would, you know, and regulations that would stop that from making it so easily accessible. And again, if there are any other colleagues on the call that want to jump in on this question about the wide availability of junk food, please come in. And then in terms of the water and sanitation question, I mean, I think our UNICEF colleagues in particular have been especially strong in leading efforts to address the need to improve school environments, and particularly the investments in infrastructure and water and sanitation. That's not really a core part of UNESCO's mandate, but we do speak out about how vitally important it is for children and young people to have access to hand washing facilities, safe and clean latrines, and all these things intersect. We talked about issues around violence and bullying, and I was recently in South Africa where a headmaster told me that the #1 location in her school where violence and bullying occurs is in the latrines. And so it's important to sort of bear that in mind and think about school infrastructure, locations, lighting, safety, whether or not these places need to be supervised. We really have to pay a lot of attention to all the factors that can contribute to an unsafe and unhealthy learning environment that would affect children's right to learn.
Thank you so much. I'm afraid that we will have to stop the questions for Mr. Castle just there at the moment. Although if people would like to comment in the chat, then please, we can keep the conversation going. And we will be, after the webinar, we will be developing the web page, and you'll be able to come back and see some of the discussions that were going on and questions that were asked. So thank you very much, Mr. Castle. It's fantastic to have you here and to set the tone with the report, to sort of give us that global view. And now we're going to go and explore a bit further in one of our regions about what has been happening, there on the ground. I did make a mistake in that there was a WooClap question that was going to accompany Mr. Castle's talk, and this was going to be about how do you rate the recovery of your school health and nutrition systems post-COVID? What is happening in your area? Do you feel that they are strong, or do you feel that those systems are weak or have been weakened? So there is a WooClap question 4 about that. And before I introduce Professor Ma, I shall just tell you about WooClap question number 5, which is going to relate, I think, quite closely to her content, which is about how would you rate the collaboration between health professionals and education professionals in schools in your area. And for that question, we've got a rating question of 1 to 5, where 1 is poor and 5 is excellent collaboration. So you can have a think about those 2 questions while we listen to Professor Ma, and then we'll be able to come back and review the answers. So without further ado, let me tell you a little bit about Professor Ma. That Dr. Yinghua Ma has been Professor of the Institute of Child and Adolescent Health at Peking University, China since 1999. And we're delighted with that she is now a UNESCO Chair for Global Health and Education since 2022. Her research focuses on child and adolescent growth and development, life skills education, and school health promotion, with numerous leadership roles in this field, such as chairperson of the school branch of the China Association of Health Promotion and Health. She's also served as Deputy Director of the China Centers for Disease Control and Prevention, and received numerous awards and honours for her contributions to child and adolescent health research and education. So, Professor Ma, our question to you for your presentation today is that China has extensive experience with school health and nutrition. How are the health and education sectors working together in China to implement an integrated approach to school health at scale and to monitor progress? We look forward to your presentation. Thank you.
Thank you, Nicola, for your kind introduction. I will screen my screen.
Super, we can see the slides, Dr. Ma.
Can you see the slide?
Yes, we can.
Okay, thank you, Nicola, for your kind introduction. I'm grateful for the opportunity provided by UNESCO and the UNESCO Chair on Global Health and Education to meet you all online to introduce the practice of a multi-sectoral school-based approach to promote students' health and well-being in China. I have prepared a few slides to respond to the question raised by Nicola, focusing on how education and health sector work together to implement and monitor an integrated approach to school health in China. Since 1979, China has established a comprehensive approach, emphasizing cross-sector collaboration, particularly between education and the health sectors. The first, clear legal and policy frameworks for the intersectoral cooperation. In 1990, with the approval of the State Council of People's Republic of China, Ministry of Education and the National Health Commission jointly promulgated the regulation on school health work, which stipulate the respective roles and the responsibility of the education and the health sectors. The regulation stipulates that the education sector is responsible for the administration and management of school health program, while health sector is responsible for monitoring and technical guidance. Education authority at all levels and schools are required to include school health in their annual education budget and integrate school health in their work plans and performance assessments. The health authority at all levels are required to organize the provision and monitoring of school health services, including health screening, prevention, referrals, etc. Currently, for education sector, the Ministry of Education has a program division to coordinate school health policy and programs at national level. For the health sector, they are the Centers of Disease Control and Health Supervision Bureaus at national, provincial, and local levels that are designated by the National Health Commission to cooperate with education authority and schools for delivery, technical guidance, and monitoring of school health services. The second, effective coordination mechanism. Within the framework of Healthy China Initiative of State Council, the education and health sectors are established a regular consultation mechanism for school-based disease prevention and control programs to formulate policies, develop implementation plans, and carry out the services, carry out the supervision and monitoring jointly. For example, the two sectors have regular meetings to review education sector responses to HIV and AIDS every year. Similar mechanisms are in place to coordinate intersectoral cooperation in response to other health threats that affect schools and students. The third, multi-sectoral advisory and technical support groups and networks. The Ministry of Education has established a number of thematic expert groups to provide advisory and technical support for the planning, implementation, monitoring, and evaluation of school health policy and programs, such as Health Education and Teaching Guidance Committee, myopia prevention and control, HIV/AIDS prevention and intervention, and etc. These groups have memberships representing all sectors and disciplines in relation to school health, including education, health, management, mental health, hospital, disease prevention, nutrition, curriculum development, teaching and research institution. In addition, professional society in the field of education and health, such as the Chinese Preventive Medicine Association, the Chinese Education Society, and the Chinese Student Nutrition and Health Promotion Association have also been facilitating intersectory collaboration and synergies and contributing to school health and nutrition. And finally, a nationwide multi-sectory student health monitoring system. Since 1985, China has conducted national surveys on physical fitness and health every 4 to 5 years among students from primary, secondary, and higher education. The 8th survey in 2019 was conducted by 6 ministries and commissions, including the education, sport, and health sectors. It investigated over 370,000 students aged from 6 to 22 in 1,258 schools nationwide. And 24 indicators related to anthropometry, psychological function, physical fitness, and health status were measured in this survey. The survey is also used to collect information on lifestyle and mental health condition. These surveys have advanced the understanding of the health status of children and adolescents, promoted the formulation of policies and interventions, and also provided the basis for evaluating the impact of school health work. The content in this slide in the red box is just showing an example of the whole process. Identify problem, decline in physical fitness, increase in obesity, increase in poor eyesight, and then formulate some policies like strengthening the young sports and enhance youth physical fitness. The State Council made this policy, and after that, putting forward a series of mirrors and the requirement, and then evaluation through this monitoring data. However, the following up surveys found obesity and myopia still increasing, and students affected tend to be younger. The government responded by re-releasing the implementation plan for comprehensive prevention and control of myopia and obesity in 2018 and 2020, respectively. And these are all of my sharing. Thank you very much for your listening and the patience, and thank you for the invitation to this webinar. Thank you.
Professor Ma, the first thing that strikes me about your presentation and about the collaboration in China is that it doesn't happen by accident. It is a lot of hard work at different levels to bring people together and to give incentives. Have you found any interesting conversations? Is the culture of education and the culture of healthcare different? You know, you obviously have a joint interest in the students. What has been the most interesting part of the work for you?
You know, sometimes when I work, I'm from the Institute of Child and Adolescent Health. Sometimes the organization from the Ministry of Education assigned some jobs for us institute, and also the Ministry of Health, National Health Commission also assigned some job for us. So sometimes when we communicate with MOE, I will stand by the Ministry of the Ministry of the National Health Commission sector, health sectors. So sometimes when we communicate with the health sectors, we will stand by the education sector. So sometimes very hard, but sometimes when you they have a good understanding between the two sectors, something that's okay. You know, like the HIV/AIDS prevention, sometimes the two sectors, they have very different strategy for this program. Thank you.
That's very interesting. So you and your colleagues are a bridge between health and education to speak both languages of health and education. That's wonderful.
Yes.
Thank you. Prof, may I ask, have we got any questions for Professor Ma, please?
Yes. Well, it's a question referring to Chris Castle, but I think it's also relevant for you, Professor Yinghua. It's a great pleasure to hear your presentation. And the question is, who is responsible for strengthening school health as stated in the UNESCO report? What is your take on that from your perspective, Professor Yinghua?
So who is responsible?
I'm sorry.
Who?
Can you repeat the question? Thank you. Thank you. Yeah.
Who is responsible for strengthening school health in, you know, as it's stated in the UNESCO report? What is your take on that? Who is responsible?
For the part of China report, you mean? Yeah, just Dongbi and I to give some input to the report. So about the survey, the student health system survey, and also some policy and health, school health education and health promoting school, something like that. We try to collect some data and the policies to input to the report of this global school health and nutrition.
And in China, do you think that health feels that it's their responsibility for student health, or that it's equal with the schools? Is there a sharing of responsibility in your experience in China?
You mean the equity to
for outcomes? I think, you know, so that if interventions are come
from the health side and the education side. Do you know? Sometimes the schools, sometimes the students' health. Sometimes they think some policy maker from health sector think this the health of students is the responsibility of the school, but the school think the students' health responsible the health education. National for the health sector will responsible to the students' health and the quality. Sometimes very different, but you know, they should to communicate to each other.
Yes, we can see the efforts that for doing that.
It's a long way, I
nice.
think, but now we have a very good situation and cooperation because we have the framework of the State Council for the Healthy China Initiative. They require the education and the health sector to establish some mechanism as a regular consultation mechanism.
Fantastic, thank you. Mr. Castle, would you like to comment? You brought back in for this question.
Yeah, thank you. Maybe just to build further on Professor Ma's response, we just had a meeting with the different interagency partners last week, and this issue always comes up. And I think that the big conclusion we confirmed is it's a shared responsibility. And we often talk about the value and importance of a multi-sectoral approach. And so that means for school health and nutrition, primarily health and education, but other sectors as well. But it's a really important question because we have seen through various studies over the years that different countries will expect a lead ministry. It can vary depending on the country. There's no one size fits all model where it's always the Ministry of Education that leads or always the Ministry of Health that leads. It can change depending on the country and the context. One of the strengths of school health and nutrition is that it's multi-sectoral. One of its challenges is that because of that, where's the accountability to make sure that it happens, that it gets done, that we collect the necessary data, we monitor its implementation. And so, it's maybe a little bit of a double-edged sword. What I am encouraged by, though, is that regardless of who's responsible, all of us on this call, whatever sector we work with, I think can see real benefits to the health and well-being and education of a child when we promote and invest in school health and nutrition.
Fantastic. Thank you so much for those very full answers. And time is pushing us on again, I'm afraid, but I was going to ask Sylvia if you might at this point pause just to show us question 4 and question 5, please, Sylvia. So we can bear these in mind as we go forward. So rating recovery post-COVID, where 1 would be a weak recovery and 5 would be a strong recovery. So this looks quite positive, but nobody said weak. And that we've moved through, most people saying, towards the strong end. So that's fantastic that we've seen, and maybe it's because, as was said earlier, seeing the impact. It's making you value what you have, and maybe schools are now seeing that there is a lot that can be done, and COVID has put things into focus for us. So question 5, please, Sylvia, and we can come back and talk about these again at the end. And you can comment in the chat about them if they surprise you. Okay, so cooperation between education and health professionals in schools in your area, a mixed picture here. Okay, so 1 at the top was for poor collaboration, 5 at the bottom was for excellent collaboration, and I think this shows me variation, but not weighted towards the excellent end. It looks like there's still work to be done with where our audience is coming from. So some food for thoughts there. Okay, so I'm going to take us into our 3rd presentation. And there is a WooCat question associated with the 3rd presentation, of course. Now, this is a different format. This is a word cloud that we're going to create. So this is where you can put in a word or a short phrase to give your response as the audience to this question, which is, how can we enable scale up of school health and nutrition programs in your area? So I don't want to lead you, but examples of words might be something like funding or training or something like that. So please have a look at that question 6 on WooClap, whilst I hand over very shortly to the very capable hands of Dr. Adesola Olumide. She is a researcher and consultant community physician at the Institute of Child Health in the University of Ibadan and University College Hospital, Nigeria. I am delighted to work with her in the International Association for Adolescent Health, where she is the Vice President for the Sub-Sahara African region. And she's also the current Secretary General for the National Society for Adolescent and Young People's Health in Nigeria. We're really looking forward to hearing your experience, Dr. Olumide. So as a consultant community physician and a researcher, what is your experience with the implementation of school health and nutrition in schools in Nigeria? Thanks so much.
Thank you very much, Sylvia, and thank you very much also to all the other presenters whose presentations have actually set a nice stage for what I'm going to be presenting today. So I'm just going to be sharing some experiences I've had with respect to how school health and nutrition have been implemented in Nigeria. I'll take us through a quick background, mention some of the nutrition policies we have in Nigeria and school health policies, and then give 3 examples of in Nigeria. At the background, Nigeria is a really popular, and our population of those who are less than 14 years is really considerable. We also know that currently in Nigeria, gross enrollment is not 100 school. We have about 86% as students move from primary school to secondary school, and by secondary school, and this data is from UNESCO. We also know that nutrition really affects the health of school children and of adolescents as well. And some studies have shown us that about 1 in 4 of school-age children in Nigeria are undernourished. And this, we know, has various consequences on them, which are short-term or long-term. And in recognition of this, we had several interventions put in place to try to reach success. And I like what Professor Castle said earlier on about the fact that it's important that beyond just implementing programs, we need to start looking seriously at how we can sustain these programs. As looking at school health and nutrition policies in Nigeria, the main one really for this is the National School Health Policy. And this policy came into being in 2006, and it is really due, long overdue, for revision. The school health policy in Nigeria is spearheaded by schools. It goes beyond just primary school and secondary school. Usually we also think about early child care centers. These are kindergartens and nursery schools. And so government is interested in ensuring that these premises are also safe and promote the health and nutrition of children. Then we also have non-formal education centers, things like the nomadic education, continuing education centers where students go to in between schools and the rest of it. These are also included and covered in our school health different aspects. One is that of healthful school environment, school feeding service, skills-based health education, school health services, and school, home, and community relationships. And indeed, when the policy was put together, part of what informed it were the guidelines from UNESCO and from WHO, and so the policy is quite comprehensive. We have the national guidelines for the prevention and control of micronutrient deficiency in Nigeria. We also have the national policy on the health and development of adolescents and young people in Nigeria for adolescents and young people. Then more recently, the Nigerian Homegrown School Feeding Strategic Plan. And all these policies and guidelines help to provide guidance for the different types of programs and policies that we have in the country with respect to food, health, and nutrition. When it comes to implementation, similar to what happens to the education, Ministry of Health, we have NGOs involved, faith-based organizations. We also have government and private hospitals being involved, academic institutions, food vendors, parents also being involved in the implementation of our school health policy. And for us, the school health policy is spearheaded by the Federal Ministry of Education. And to what extent then has this policy been implemented? I have great all the different components, that yes, definitely things have school environments most times, oftentimes have better elements at their disposal. Also, as models, the older government schools, you have the alumni associations that contribute to ensuring that the school environment is conducive for learning, the school environment is safe, and the school environment is one. We do have school feeding service as well, and I'll be giving us an example of the Nigerian school feeding program. Then we have school-based health education too. In these components, we have things like the expanded life planning education, which is sexuality education that is taught to adolescents in school. They also have physical and health education, and various health-based topics are taken in schools. In this aspect also, you have the health clubs that you have in a number of the schools as well. So these are various ways through which the health and nutrition of in-school students is taken care of. You have school health services. These vary. Sometimes you have the school nurse in the school. Sometimes you have a sick bay in the school. And sometimes also you have some schools having retainerships with private hospitals in town so that they can take the students there to receive care. Then school, home, and community relationships. This has also been implemented to some extent. Many times what we have here is the Parent Teachers Association trying to see what they can also do to contribute to the health and well-being of their pupils that are in school. So looking at some experiences, I'll be drawing from three of them. A little bit of the findings of the study we did to assess it, knowing that the students spend a lot of time in school with their teachers, and that the teachers as well have a role to play in ensuring that the students are healthy and that they are well fed. And I'll also talk about our national homegrown school feeding program, and then mention more recently steps that have been taken to implement WHO school health guidelines in Nigeria. For the school health services, looking at early detection, like I said, we to screen for selected impairments and hyperactivity disorders among some primary school pupils and 40 teachers. And of these, about 55 of them, about 8% of them actually mentioned that if you screen people, they did not mention being able to use the Snenos chart, but they looked out for other pointers, other things that they felt could indicate that the child was having problems with vision. And they usually followed up with the parents, first of all with the school principal, and then with the parents. And so they recognized that they had a part to play when it comes to early diagnosis of some impairments. With respect to hearing impairments, about 108 of them mentioned that they would have a sense, or they would suspect that the people might have a hearing impairment if the people perpetually get inappropriate answers to questions. And so they didn't know how to use any of the equipment, but they could tell if a child, or they could suspect if a child had a hearing impairment. And then they would follow up by sending for the parents or reporting this to the head teacher. However, some teachers were a bit skeptical about this because they said that especially in government schools, when parents couldn't afford to take their people to the students, their children, to hospital, it was a problem when they identified these issues with them, because sometimes the parents would expect that they as the teachers would be the ones to fund. Sometimes we're a bit skeptical about pointing this out. Might be struggling with hearing if the child was out and the child wasn't funded. Looking at hyperactivity disorders, about some 5% of teachers said that they would consider that the people might have an underlying problem that made him or her hyperactive if he or she was excessively restless and had poor concentration. One good thing we noticed about the teachers was that they were hesitant to stigmatize their pupils. However, if they felt that the pupils might have a problem, they were willing to go to the teacher, to the head teacher, to express their concerns and see what the parents will do to take this further. And some of what came up from this study was that teacher skills in early detection can be improved with training, and that teachers are willing to do this because for them, they were concerned that the school should be able to learn maximally in school, and that they understood also that the school environment could be a place where for the very first time an impairment is detected in a child. Now, looking at the National Homegrown School Feeding Program, prior to 2016, we had different types of school feeding programs in schools, different variants of this, and in line with best practices as well, foreign governments also realized that it's important that for children to be able to concentrate in school, for them to be healthy in school, they should be given at least one meal a day. And so this program was launched in 2016, and the aim was, the overall goal was to provide a nutritious and balanced meal to primary 1 to 3 pupils in government-owned primary school, because this actually is a cost-intensive program. Some of the aims of the program were to enhance school enrollment, retention, and completion, to improve nutrition and health of primary school children, also to encourage local agricultural production, because some of the produce that was used to prepare this meal were supposed to be sourced from the local farmers. And so it was sustainability of the program could be enhanced. It was also felt that it was important to try to create jobs for community members, and in this will increase state and national economy. Food, the vendors from the to prepare the meals and serve the meals were drawn from within the community where the schools were located. So how then did we prepare? There have been several short-term evaluations of the immediate impact demonstrated some short-term successes. And by 2018, it was said that about 10 million primary school children had been reached. An evaluation that was conducted in one of the states where this was implemented, that's in Osun State, showed the improved nutritional status of the pupils. In about 3 of the evaluations that were also conducted, they had noticed that there was improved school enrollment and retention. And indeed, in Osun State, they noticed that many school pupils many parents of school pupils moved their pupils from their children from private schools to government schools because of the 1 meal a day. And there was also increased job opportunity. However, there were also some barriers noticed, and one was inadequate funds. 2 was the fact that people felt there was selective implementation. 1, the fact that it stopped at only primary 3. So in Nigeria, in primary school, there are 6 classes of primary school, primaries 1 to 6. And so people felt that selectively focused was not very good for those in the older classes. And some teachers actually reported that during break, when the primaries 1 to 3 pupils were at the window, and we're also looking and trying to see would this ever get to them. So selective implementation was a problem. In some instances also there was poor coordination. So poor coordination between the vendors, poor coordination between when government was going to bring funds, poor coordination sometimes between the cooks. And so these were some of the barriers that were noticed. However, there have been efforts ongoing as government is preparing to scale up the program. So the final example is looking at the WHO guideline on school health services, and this was recently developed. And so currently, government is trying to see how we can implement this. And so we are still at the basis. Ministry of Education and Ministry of Health we brought together to implement this, knowing fully well that it's not the job of just one ministry.
Dr. Olumide, I'd be grateful if we could just have 1 more minute, please.
Yes, this is my last slide. Okay, so it's trying to see how both the Ministry of Education and Ministry of Health could be brought together to work together to implement this program. And one thing they have done is to piggyback on the Technical Working Group for Adolescent Health, because that has representation from various sectors, from Ministry of Education, Ministry of Health, and Education as well. And so in conclusion, we know that health, including nutrition and education, are closely related. And we have had a range of interventions to address school health nutrition in Nigeria with varying degrees of successes. And it's important to ensure sustainability of these interventions so that lasting impact can be attained. Thank you very much.
Thank you so much. It's really valuable to hear your experience, and the chat has been going crazy because I think that there are a lot of members of the audience who are interested in your situation. So I can see one of the things that struck me, and you said that the other speakers are building a great foundation for, you know, each following presentation, and the role of the community and the role of parents came out very strongly in your presentation. I thought, you know, choices that were being made, efforts that parents were making to, you know, to improve the situation. Do you find that as a really strong connection there with schools, with parents?
Yes, so it is a very strong connection, interested. And if there are no meetings, they go to the school and they ask the teachers, head teachers about these meetings because they want to be involved. In some other schools, parents are quite happy to have the teachers and the schools take all the responsibility and they are fine with what happens. So it varies really. I think also one other thing that makes parents interested is if they think that there's an opportunity for them also to become school vendors.
Okay.
And to be able to be cooks. So that actually inspires a lot more interest. So it varies.
Fascinating. Okay, thank you so much. I'm going to ask Sylvia if you might put up the results. If we'll bring down your slides, Dr. Olumide, and if perhaps Sylvia could put up the results of the WUCAT. Wow. Okay, you've been busy. This is a fantastic audience. Well, so what happens is when a word is used more and more, then it becomes bigger in the word cloud. So what we see here is people, health at the heart of this word cloud. So if you remember, the question was, what are the enablers to scale up of school health and nutrition programs? What's your reaction to that, Dr. Olumide?
All right, so really I'm happy that we can see people at the center, because people are really the ones that are going to drive the scale up of this program. People in different sectors, even people also in the private sector, because many times people tend to think it's government business and government should do everything. But we do know that when the private sector is involved, a lot of times that helps sustainability. Then health is also important, because when parents start to see that their children look healthy, they feel that government is doing something for them because it's something that they can see immediately, and they are willing a lot of times to contribute as well to see that this program goes on. So yeah, people definitely help, definitely. And also schools as well. When you have head teachers who are interested in the program, who want to see the program work, a lot of times that helps to sustain the program too.
Fantastic. So this is very heartening stuff. I'm really interested in the diversity of words that I can see in here. So I can see things about law, I can see things about funding, I think, yeah, finance and tax, connecting with school boards. So there's a lot of experience that has been put into one word cloud, I think, from our audience, and we're very, very grateful for that. And that will be available on the website when we've developed the web page after the webinar for you to come back to. Okay, thank you so much, Dr. Olumide. Fantastic. Another perspective on our situation. And this brings me to the final presentation of our webinar. I shall just set the WUCAT question going, shall I again? Just let you know that this is going to be question 7. And it fits very nicely with Professor Bundy's presentation, because it is, where do you as the audience think we need more research about school health and nutrition programs? And your choices are implementation and scale up, effectiveness, including cost effectiveness, inclusion and equity, important from the report, and sustainability, including the workforce of these different sectors. So have a think about that, and let me introduce you to Professor Don Bundy, who is a Professor of Epidemiology and Development in the London School of Hygiene and Tropical Medicine. He is the director of the new Research Consortium for School Health and Nutrition of the School Meals Coalition. The fascinating path leading to his current role, includes being a professor in the Epidemiology Centre at the University of Oxford, a lead education and health specialist to the World Bank, and a senior advisor to the global health team of the Bill and Melinda Gates Foundation. So we're looking forward to your perspective, Professor Bundy. It's all about the research. How can the global research community help fill evidence gaps and advance more effective approaches to school health and nutrition? Thank you so much.
Great, thank you very much, Dr. Gray. And I think we're going to kick off, aren't we, with a video to, I think that's being shown from your end.
Sorry, Sylvia, please.
Next, we will hear from another commitment to action, this time around a very important initiative that has attracted a lot of interest this past year, and a half against a backdrop of closed schools and lockdowns. I am delighted to give the floor right now to the School Meals Coalition.
Finland has been actively promoting the establishment of the School Meal Coalition.
Argentina ha adherido a la coalición de comedores escolares.
Mon pays s'attelle à la mise en œuvre de cantines scolaires en privilégiant leur approvisionnement auprès d'acteurs locaux.
The African Union Development Agency, NEPAD, has worked to facilitate an African common position in advance of this summit with the following priority tracks. 1. Adopt nutrition food policies, establish food reserves, and expand school feeding programs.
I am pleased that Kenya is taking leadership in the School Meals Coalition.
The Agriculture for School Lunch project is one of our success stories in addressing food insecurity and malnutrition.
So as to deliver safe, healthy, and nutritious school meals.
Our support to the School Feeding Coalition.
Guatemala se adhirió a la coalición de alimentación escolar.
And we therefore support the coalition on school feeding and commit ourselves to achieving the goal.
School meals.
The school meal.
Y es que firmamos la Coalición para la Alimentación Escolar.
We are pleased to have joined the School Meals Coalition.
My country, Luxembourg, is particularly proud to join the School Meals Coalition. The establishment of effective school meal programs represents a smart investment into future generations as well as into more sustainable humanitarian action and development aid.
We look forward to working with so many of you through the global coalition called School Meals Nutrition, Health and Education for Every Child, to ensure that every child has access to nutritious meals in school by 2030.
La Principauté a annoncé son soutien à la Coalition pour les repas scolaires, nutrition, santé et éducation pour tous les enfants.
Coalition sur les cantines scolaires.
Schools Meals Coalition.
La Coalition des programmes alimentaires scolaires.
School Meals.
School Meals.
La France appuie également la Coalition pour l'alimentation scolaire.
We already support the School Meal Coalitions.
Bénin s'est engagé à jouer un rôle prépondérant au sein de la Coalition mondiale pour l'alimentation scolaire.
I'm pleased to see many member states rallying around universal access to nutritious meals in schools. A great example of how social protection can support resilience, food security, and the rights of children and young people.
Join us, sign the declaration, make your commitment known, and help the School Meals Coalition ensure that every child has a healthy, nutritious meal every day. Thank you for joining us today.
Great. Well, thank you all. I thought I started at that because I felt it was important to show that we really had a global movement here on the issue of school meals and school health, and that's really describing what happened in October 2021 when the UN summit focused on the issue of food and nutrition. So all of those countries came together. It's now 79 countries. Here's the map. It's a truly global initiative with more than half of the world's population being in these countries backing this work together. And the point that I really wanted to make was that, that I've been asked to talk a bit about what should countries do, but I wanted to explain a little bit about what countries are doing to identify the gaps. And I also want to make the point throughout this presentation that if any of you want to be part of this initiative, you're very welcome. This is a global effort, and it's a truly global partnership. So let me try and explain a bit more in the detail of what that's about. So let me just say first that the goals of the School Meals Coalition, the 3 goals. One was to build back the school meals programs to the size they were in 2020 before the COVID pandemic. So in those days, 388 million children, nearly half the world's primary school children were being fed. Get back to there. Secondly, reach that 73 million children who've never been part of the school meals program, the most vulnerable children. And finally, to really build programs that take into account not just meals, but the whole health and development spectrum for young people. Chris Castle's presentation at the beginning, just super, I think, about explaining about learning and thriving and how those two things are part of the development of a young person into adulthood. The next slide, just give you an idea of the research dimension. So all of those countries we heard of, as I say, now 79 countries, decided that they needed to understand better what's the evidence for how best to intervene in school meals and school health. What are the evidence gaps? What is it we should be doing about it? And they asked for the establishment of a research consortium for school health and nutrition, a global consortium to support the Global School Meals Coalition. And here's the structure. All the countries are the boss. The countries are on top. There's a very small secretariat at the London School of Hygiene and Tropical Medicine. That's where I'm based. But the real work of all of this is done through a series of community of practices. And I'm going to go through each of those six communities of practice. These are spread across the world, and as far as we can, we're trying to deliver equitable partnerships. In other words, opportunities for everyone to really lead, to provide thought leadership on this work. And we'll only do it if you join. So please join. So what are these communities of practice? The first one I want to talk about is analytics and metrics. This was one of the first that was established. It's a community of practice that focuses on two really main issues. One is value for money in school health programs. What's the return? We've seen several figures, $9 for every dollar invested, for example, but also very specifically asking questions about education returns. What's the benefits to a child of well-being in terms of their ultimate educational achievements? It's a key part of the question. So that's one area of work, and there we're working already in 8 African countries, programs led by the countries themselves in multi-sectoral programs with local scientists as part of the team, and also very specific studies. One particular one on impacts of malaria on learning outcomes. Well, the next community of practice is the impact and evidence group. Back in 2007, many of you will be aware of a study that was led at that time by Betsy Christensen from the University of Ottawa. Well, Betsy's leading this one, but she has a very large team across the world helping her look at all the studies that are available in this area. In 2007, when the last systematic trial was run, there were 18 studies. Now there are something like 70 studies. So we were just waiting for the results of that systematic trial, which will likely to be in the next few months. But the next example is itself a good example, and this is actually a core issue. This is really what countries are interested in hearing about. This is a group that's looking at the case studies for individual countries. The aim is that all 79 countries will, in the end, submit case studies. Already there are more than 20 case studies ongoing, studies in Malawi, Canada, France, Japan, and the USA, across the world, studies that are going to provide evidence for what programs are like. And I just bring your attention to Professor Ma's excellent presentation on the situation in China and how much we could learn from her description of the case study. I hope Prof Ma will be part of the case study development for this community of practice. And the next one is the nutrition measurement community of practice. This is one that looked at the extraordinary reality that we really don't have indicators for measuring nutritional development, standardized indicators in school-age children and adolescents. And indeed, much of the nutrition work is not focused on those age groups, but focused on much younger children. We need to think of course, we need to support the young children, but we need to also maintain great support throughout the childhood. And I particularly enjoyed Dr. Olumide's presentation on the program in Nigeria, which has shown spectacular growth over the last 3 years, from reaching 1 million children to reaching now 10 million children with nutritious meals based on locally grown foods. Fantastic. These are the kinds of issues that we're getting into. And then the next community of practice is one which I'm hoping some people listening to this talk will participate in. This is for early career researchers and young scientists. No one's too young to be part of this. The idea of this is to encourage people to adopt careers where they look at this interface between health and education. It's not a traditional area of research. We need to support people to take them forward on that. This community of practice is being formally launched in a week or two on the 4th of May, and I hope you'll all be part of that. And finally, the most recent community of practice is diet and food systems. So this is about, okay, nutrition's vitally important, but can we support a menu in school that's based on locally produced foods? We heard from Dr. Olumide that was being done in Nigeria. We know, of course, that's also done from Professor Ma in China. But why do we understand, how can we understand those connections better? And as a high point of this particular piece of work, there's also a presentation being developed for COP28 in Dubai later this year, a climate smart approach to school meals, which we're working hard with, again, with a group across the world to try and develop a clear common vision of what climate smart school meals programs would look like. Well, I want to finish on a very high and positive note. We heard from Chris Castle about 388 million children who are being fed in 2020. And you'll remember that the first goal of the School Meals Coalition was to build that back. Well, we can all start clapping at this point, because indeed that's been achieved, that in the survey conducted last year, 418 million children again are now being fed in these programs. That doesn't mean we're reaching all the children that need it. We're least effective where we're needed most. Lots of more work needs to be done. But this is success, and it's a sign that the governments really have got behind this issue. And finally, this is the slide. If you want to join us in any of these ways, and we look forward to connecting with you and working with you as we move forward in this area. Thank you. Thank you, Dr. Gray.
Thanks so much, Professor Bundy. That was excellent, high energy, and really looking at these communities of practice, it's really exciting to see, the different topics that are being taken forward. I wondered whether Sylvia might like to share the answer to the WooClap so we can have a look and see where our audience thought that research was needed.
Yeah, I'm really interested in this result.
Ooh, okay. So we've got implementation and scale up, and then effectiveness. It's like steps of stairs going down, and then inclusion and equity, and then sustainability. So interesting. Obviously, a lot of interest in each of those areas, but some priorities there. Does that surprise you, Professor Bundy?
Well, I see the priority is how to do it, and I think that is what people say. What is it we do? What is the best thing we can do? And that's exactly what we're trying to find out.
Fantastic. And I guess that links back to your case studies and the good examples as well. Hof, may I ask if we have a question for Professor Bundy from the Q&A, please?
Well, there was more an observation than a question to you, Professor Bundy, but maybe you can reflect on that. Somebody remarked that it should not just be a linkages, but also a chain link, where everyone is joined in a chained link to accelerate school health. And maybe you can say something about that.
Well, I think that's, I think one of the things that's been very clear from all of the presentations this afternoon is that this is a multi-sectoral piece of work. It's health, it's education, it's social protection, it's agriculture, it's politics, but it's also how to do it. So all of these pieces have to come together to make this work. So it's a great observation.
Thanks very much for that. Well, we've just reached the hour mark, and so we're going to ask you to indulge us. I hope that many of you can stay online for the last 10. We think we'll run over for about 10 minutes or so if you'd like to stay with us, because we have a common question, and maybe if I can go back to Sylvia, who will put this up on screen for us, that we would like to ask all of our panelists today. So reflecting on these excellent presentations, we're homing in on one element of the report, that school health and nutrition programmes promote inclusion and equity, with a warning that more must be done to reach those who are missing out. So I'm going to ask each of our panel members if they would like to turn on their cameras again, and I will go back in the order of the original presentation. So I'll go to Mr. Castle first. Is what do you think is a strategy, something that decision makers could do now to make a difference for a group of students who are missing out? So I just go to Mr. Castle first.
Well, thanks very much once again, Professor Gray, for a really excellent webinar. It's been fantastic presentations and a great discussion and dialogue on a really important topic. With regards to the question, one thing that I've heard come up a number of times, and I keep hearing over and over again, is again this issue of mental health as an area of well-being that really urgently needs much more attention and focus. So I think as we're moving forward in the process of supporting holistic, comprehensive, integrated school health and nutrition programs, let's not forget that we really do have an alarming situation with regards to young people's mental health and well-being that requires that we all think about how we can respond to that better. I know that some of the partners in the interagency group, particularly UNICEF, have really invested and shown quite a lot of leadership when it comes to mental health issues and what we can do through school health programs around that. And so I guess for me, that's a cross-cutting issue, regardless of whether you're rich or poor, urban or rural, whatever your situation is. I really think it's long overdue that we get more serious about addressing mental health of children and young people. Thanks very much.
Thank you. Superb. Professor Ma, what would you think?
Thank you. Thank you again for the invitation. And thank you, Professor Bundy, for your interest in my presentation as well. Thank you. And to ensure school health services to benefit all learners, decision-making should have robust system and mechanisms in place to identify who are missing out on these services. This required proactive effort to gather data through regular health screening on marginalized groups, such as left-hand children in China, children of migrant workers left behind at hometown, and monitoring and evaluation school health program. And decision makers must also ensure that sufficient resources are allocated to meet the unmet health need of this group. In China, left behind children are one such group that need urgent attention. They often lack access to essential health services due to their rural location and the social disadvantage. In particular, the lack of mental health and psychological support in absence of their parents. make it crucial to implement targeted interventions that address their specific health needs. And thank you. This is my thinking.
Thank you. Okay, excellent perspectives coming out here and lots of children potentially missing out. Dr. Olumide, what would you like to add?
All right, thank you very much, Dr. Gray. I would say that it's important that our government reaches out to out-of-school children, because even though as much as they're hoping that the school, we try and find out what is then keeping them out of school so they can bridge that gap and ensure that they come into school and also enjoy business. Otherwise, we are failing them.
Thank you for that. There was a slight wobble with the sound, but it was very much about those who are out of school, students, making sure that students have every opportunity to get into school and take advantage of the meals and the services. I summarised that appropriately. Professor Bundy, what would you like to add?
So I think one of the things that really attracts all of us to this area of work is the extraordinary scale at which we're able to operate, that countries are able to operate. This is 400 million children being fed every day, and more than 90% of them getting health interventions as well. So let's not minimize the huge value of what's going on. But at the same time, of course, there's, as the School Meals Coalition has recognized, there are 73 million children who are amongst the most vulnerable who are not being reached. So we've got to do, we can't deny it. We have to do both of those things. We have to keep going at scale, but we also have to take care of those who are most vulnerable and who are missing out. That would be my answer.
Thank you very much. Yes, going back to the tone and to bring us back to the report and back to the excellent work that our panelists are doing. If you haven't read the report, then you must read the report. The highlights and the full version of the multi-agency report about Ready to Learn and Thrive is available, and we will be putting links on the web page, and you will have that to refer to as an amazing resource published for the first time. It's fantastic to see that we've had regions of the world represented here today, both in our audience and in our panelists, where we can really compare our perspectives and gather the diversity and the richness of what is going on. And for that reason, I don't know whether everybody who's here on the panelist stage would like to put their cameras on for a moment. I'm sorry, that might have come as a shock. But I would like to thank everybody who's been involved. Obviously, first to our speakers who have brought such pearls of knowledge and to us today. To our technical team, Sylvia and Rolf, fantastic. Thank you so much for supporting all of us. And to Emily and Yongfeng, who are here from UNESCO, thanks from the chair, because you've been our central contacts who have helped us to bring everything together. And it was fantastic to work with you as well on the report and on the work that the chair does. So thank you very much for your contributions as well. And to everybody here, I think there are lots of opportunities for you to stay involved. There are opportunities to read the report. There are opportunities to join the research consortium. There are opportunities to join the UNESCO chairs community. So please do come back to our website when everything has been edited and all the resources are available. And we wish you all the very best with your own school health and nutrition activities. And please do try and keep the conversation going with us. We are all interested, and we will all stay that way. So thank you very much, everybody, for joining us today. And whatever time of day it might be for you, I hope that your day continues well. Thank you so much.